The head of the Centers for Disease Control and Prevention says a coronavirus vaccine won't be widely available until next year. Dr. Robert Redfield testified before a Senate subcommittee on Wednesday. He discussed when a COVID-19 vaccine would be ready and how it will be distributed. But his timeline stands in stark contrast to what President Trump has been saying. Paula Reid has the details.
President Trump on the defensive tonight after his own CDC director contradicted his outlook on vaccines and negative rhetoric on masks.
It was an incorrect statement.
Dr. Robert Redfield today touting the use of masks as a potentially greater benefit than a vaccine.
These face masks are the most important, powerful public health tool we have.
After President Trump suggested masks aren't always popular in a town hall last night.
A lot of people don't want to wear masks. There are a lot of people think the masks are not good.
He reiterated his concerns with masks tonight.
The masks have problems, too.
That, too, was contradicted by Redfield, who said a vaccine for all Americans won't be available until next summer or fall.
I think we're probably looking at late second quarter, third quarter, 2021.
The president tonight saying that is incorrect.
I called him. I said, what did you mean by that? And I think he just made a mistake. He just made a mistake. I think he misunderstood the question.
Former Vice President Joe Biden said the disconnect between the president and his top health officials is harming the country.
Let me be clear. I trust vaccines. I trust scientists, but I don't trust Donald Trump. And at this moment, the American people can't either.
Biden also took issue with the president's claim that he should have called for masks to be required nationwide.
I found it fascinating the president said, and Biden didn't put in a mask mandate. I don't know how old he is, but I'm not the president. He's the president.
And Paula Reid joins me now from the White House. Hey there, Paula. As you mentioned, President Trump and his administration continue to send mixed signals over a possible vaccine, its timeline, and about mask wearing. Why the disconnect? And I understand that Dr. Redfield is not backing down under presidential pressure.
That's right. We've seen this consistently throughout the pandemic response from this administration. So often the message is do as we say, not as we do. They'll tell people not to shake hands, to socially distance. They won't do it. And even within themselves, within the task force, you get differing opinions on certain issues, particularly related to the efficiency or the efficacy of masks. Now, tonight, Dr. Redfield, he is doubling down. He is saying that he still 100% believes in the importance of vaccines. And also, he says that the best defense we currently have against this virus are the mitigation efforts, like wearing a mask, washing your hands, social distancing. So even though the president tried to suggest multiple times that Dr. Redfield did not understand the questions that he was asked on the Hill today, and that's what explains the contradictory statements. In fact, Dr. Redfield, he is sticking to his story. He still believes that masks are the best thing that we have until we get a vaccine. But he also said he wants to wait until there is a safe, 100% safe and effective vaccine available.
And the Department of Health and Human Services announced today the departure of spokesman Michael Caputo. Paula, will you talk to us a little bit about what this means for the White House?
Well, the White House here is losing one of their most ardent supporters on messaging on coronavirus. But Mr. Caputo has faced some pretty fierce criticism this week for admitting to try to alter the data coming out of the CDC. He has also suggested in a Facebook Live that there are deep state actors within the, quote, bowels of the CDC trying to thwart the president. But today he announced that he is going to take a leave of absence. While he had previously told CBS News he was facing some mental health challenges, in a statement today, he in fact said he wants to address some lymphatic system issues that have been lingering. So it appears to be more of a physical health issue that he says today is prompting this leave of absence.
And meanwhile, the president also says that he has an alternative health care plan that's ready to replace the Affordable Care Act. He also claimed that it would protect people with pre-existing conditions. But this isn't the first time that the president has claimed this. And again, some of the president's top health officials say that they aren't aware of any such plan. Paula, I'm wondering what you can tell us is the latest on what we're hearing from the Trump administration.
Well, the president has repeatedly said for months and months that he has a health care plan. He said back in August that it would be released in 2 weeks. We're at least 6 or 7 weeks from that statement. I've asked the president repeatedly. We've asked various White House officials. They continue to kick the can down the road, but insist that the president has a health care plan. But it becomes harder and harder to believe when the White House cannot provide any specifics. And today, when pressed, the White House press secretary really could not provide any details or even talk about who exactly was working on this policy. Now, earlier today, the Chief of Staff, Mark Meadows, suggested that this may be more of an executive action than any sort of legislative initiative. It would be very hard, arguably, to pass something like a health care plan through Congress right now, especially as we get closer to the election. But the president, it does not appear that he would be able to, for example, overturn Obamacare through executive action. Just legally, that's not the way that is done. So at this point, the White House claims that there is a health care plan the president will present, but they've been claiming that for weeks and weeks. And so far, the White House has not been able to provide any specifics about what's in that plan or who is working on it.
And Paula, I thought it was especially interesting that Mark Meadows said that they were looking at executive action, particularly when so much of what we've heard as criticisms of the Obama administration coming from the president have been his use of executive action. So to do something using executive action on health care just strikes me as so contradictory to the messages that we heard from candidate Trump out on the campaign trail. Any more explanation about what seems to be a very big contradiction coming from the president's chief of staff?
Well, certainly, this administration has certainly used executive action for a variety of different things. Now, in some cases, the president was able to issue executive action. Some of the ones he's issued on immigration in particular, for example, his quote-unquote Muslim ban, that had to go through some revisions before it could actually be enacted. But this administration has certainly tested the bounds of administrative action, of executive action. But when it comes specifically to health care, Obamacare was, of course, a law that was passed through Congress. It cannot be really overturned or upended purely through administrative action. There may be some minor administrative tweaks the president may be able to make to the healthcare system, but until we see exactly what he wants to do, it's hard to really judge. But yes, it is always interesting to hear all the different presidents and their interpretation of executive power. But one thing that really makes the Trump administration an interesting legal beat as a recovering lawyer is they're always testing the bounds of executive power. But whenever they do that, it almost instantly gets tied up in the courts. And we know we're just several weeks away from the election. So it's unlikely, even if he issues a health care plan, it's litigated, it's unlikely there's going to be any sort of definitive answer on this before the election.
All right. Paula Reid, thank you.